I'm going to reveal 4 everyday foods that genuine clinical research confirms can reduce the thickening inside your blood vessels. Not speculation, not hearsay. Documented on actual scans in living patients across multiple years. And I have the evidence to support every single claim. I'm a cardiac surgeon with 20 years inside the operating room. I've spent my career opening chests and examining diseased vessels firsthand. I've felt rigid arteries in my palms. I've witnessed deposits that transformed flexible tubes into stiff piping. And I'll tell you plainly, the reality of reversing arterial damage is far stranger and more hopeful than the fables sold across the internet. The web overflows with useless advice. Citrus water to melt obstructions, vinegar rinses to scrub your vessels, a single clove supplement to dissolve cholesterol while you sleep. None of it holds up. Your circulatory system isn't household plumbing. Deposits aren't simply sticky residue clinging to a surface. You cannot swallow a potion and awaken with pristine arteries at dawn. That isn't how biology functions. Any clip promising such miracles is deceiving you outright. I know this because I've witnessed the genuine process unfolding inside a narrowed artery. When I access a chest for bypass surgery, what confronts me isn't kitchen grease. It's your own body waging war against itself. Deposits accumulate because your immune system assaults cholesterol that penetrated the vessel lining and became oxidized. Grasp that mechanism, and you'll comprehend why the dietary approach I'm outlining isn't folk medicine. It targets that precise breakdown, step by step, and I'll present the actual proof, not merely appeal to your trust. Here's the uncomfortable truth most sources avoid. Our strongest studies don't depict arteries flipping from obstructed to spotless within weeks. What they reveal is more peculiar. A particular nutritional pattern sustained for years genuinely reduces the measured thickness of the arterial lining. Physicians can observe this on a straightforward ultrasound. Meanwhile, individuals following the conventional low-fat guidance deteriorated across those identical years. That's no myth. That's a verified measurable gain in genuine cardiac patients, and it holds more power precisely because it's real. Stick with me, because by the conclusion, you'll grasp exactly what's occurring inside your own vessels at this very moment. You'll realize why the low-fat counsel most of us absorbed from childhood actually sabotages your progress. You'll see why your statin prescription alone was never destined to suffice, and you'll master the precise 4 items, the precise quantities, and the precise sequence for implementing them. So your arteries shift in the direction mine moved for Robert, not the direction they traveled for those who altered nothing. This isn't conjecture. This is validated proof from published trials, and it delivers results. To appreciate why this approach succeeds, you must first comprehend the drama unfolding within your arterial wall. Picture your vessel like a flexible conduit. The interior lining should remain slick, permitting blood to glide effortlessly. It also produces a molecule that helps the conduit relax and dilate. When that interior surface sustains injury from elevated pressure, from tobacco, from decades of poor nutrition, it ceases manufacturing sufficient amounts of that molecule. It becomes adhesive. Tiny fissures appear, and cholesterol seeps through those fissures into the wall of the conduit. If it merely rested there passively, no harm would follow. But it doesn't remain passive. It spoils, like perishable food abandoned on a counter. And once spoiled, your immune apparatus assaults it as though it were a pathogen. Your body dispatches scavenger cells to engulf it. However, the volume overwhelms them. Those scavenger cells engorge on fat and transform into entities called foam cells. A cluster of these foam cells represents the earliest visible indication of arterial buildup. And here's the segment hardly anyone clarifies for you. The genuine hazard never resided in the narrowing itself. Deposits aren't one solid, stable mass. They behave more like a tender blister, with a fragile membrane stretched over a collection of deceased cells and fatty sludge. When that fragile membrane ruptures, a clot materializes in seconds, and circulation halts. Within your cardiac muscle, that constitutes a heart attack. Inside your cranium, that's a stroke. This explains why an obstruction merely 40% closed, one invisible on a standard stress examination, can still end your life tomorrow. Size was never the authentic menace. vulnerability was. Let me recount the case of my patient, Robert, 66 years old, former bookkeeper. He presented to me after a routine cervical scan detected preliminary buildup and a narrowing not yet severe enough to warrant surgery. He was already taking his prescribed statin. He was already consuming the conventional low-fat fare most of us inherited. His lipid figures hadn't budged in 2 years. Robert posed the precise question every doubtful patient raises. My physician instructed me to eliminate fat. Now you're advising me to ingest more olive oil. I informed him his physician wasn't incorrect to desire a lower cholesterol figure, but a low-fat regimen was never designed to pacify what was authentically transpiring inside his vessel lining. So, we reconstructed his plate entirely. Nitrate-dense leafy vegetables daily, genuine robust olive oil replacing his former cooking fat, a foundation of legumes, a modest daily ration of walnuts. His statin dosage never altered. We repeated his cervical scan 5 years subsequently. His arterial wall had measurably thinned. Only a minor reduction, but genuine. Conversely, those who maintained the standard low-fat protocol deteriorated across that identical interval. His blood pressure had declined as well. That isn't a sensational transformation photograph. That's a genuine, replicable movement toward improvement, sustained for years, not mere weeks. Now, let's construct the 4 components of this strategy. Each one confronts a distinct facet of the malfunction unfolding within your vessel lining. The first component is nitrate-dense leafy vegetables, arugula, spinach, or beetroot. 2 to 3 cupfuls daily, raw, whenever feasible, since heat degrades a portion of the nitrate. Here's the rationale for its importance. The sleek interior lining of your vessel requires the capacity to produce that molecule, which maintains relaxation and openness. In compromised vessels, that mechanism is already impaired. Consuming nitrate-dense vegetation furnishes your body the substrate to manufacture that molecule anew via an entirely separate biological route. Investigations employing beetroot extract have demonstrated measurable improvement in pressure and vascular responsiveness within hours following a solitary dose. I wish to be completely candid with you at this juncture. Not every trial concurs. One investigation involving subjects with advanced metabolic disease found the effect was blunted within that cohort. However, broadly speaking, particularly for older adults, and particularly across extended periods, this stands among the more robustly validated food-based instruments we possess for restoring that protective molecule to your vasculature. And there exists one factor capable of demolishing this whole process instantly: potent antiseptic mouth rinse. It annihilates the precise microorganisms residing on your tongue that convert the nitrate into a usable form. Employ it twice daily, and you could consume leafy greens until your complexion changes hue and derive essentially none of the advantage. Simply brush and clean between teeth. Omit the rinse. But this element alone merely clears the path. It doesn't shift the debris already embedded within the lining. That mission falls to the second component, and it carries the most powerful validation of anything on this list: genuine, robust, extra virgin olive oil, not the commonplace bottle languishing on a shelf for 12 months. It must be authentic, cold-pressed, and recently harvested. The crucial compound here deteriorates swiftly with mishandling and age. In a landmark study conducted in Spain, over 1,000 subjects already diagnosed with cardiac illness were divided into 2 cohorts. One cohort consumed a low-fat diet. The other consumed a nutritional pattern constructed around this specific variety of olive oil. Researchers gauged the thickness of the arterial wall via a straightforward scan at the 5-year mark and again at 7 years. The olive oil cohort's vessels grew measurably slimmer. The low-fat cohort's vessels worsened across that identical period. A linked study discovered the same olive oil-rich dietary pattern lowered inflammatory markers inside the vessels and decreased plaque dimensions relative to conventional guidance. This ranks among the most solidly established nutritional discoveries across all cardiac research. This is precisely why I don't want you cooking with inexpensive refined oil that's essentially pure fat, stripped of all beneficial constituents. Seek out extra virgin, a harvest date within the preceding 12 months, housed in dark glass. 3 to 4 spoonfuls daily, utilized as a replacement for your existing cooking fat, not drizzled atop everything else indiscriminately. Yet olive oil helps extract the debris. It doesn't halt fresh debris from originating in the first instance. That role belongs to the third component, a foundation of oats, beans, lentils, or barley, occupying the central portion of your plate rather than pushed to the periphery. Numerous aggregated analyses demonstrate this class of fiber reduces both your overall cholesterol and your harmful cholesterol in a genuine, moderate fashion. Concentrated oat fiber specifically has diminished harmful cholesterol by roughly 5 to 12% across a span of weeks. That isn't dramatic when viewed in isolation, and I won't pretend otherwise, but it costs nothing extra. It carries zero adverse effects, and it operates silently in the background while the olive oil and greens perform their functions up front. A daily serving of porridge or a cup of cooked beans or lentils places you within the parameters employed in these investigations. The fourth component is a modest daily portion of tree nuts, walnuts in particular. This derives from the identical Spanish study I referenced earlier. The group following this dietary pattern plus nuts exhibited lower indicators of inflammation tied directly to plaque genesis, positioned right alongside the olive oil group. Both unmistakably outperformed the standard low-fat counsel across 5 years. Roughly an ounce daily, a small palmful, represents the quantity utilized in that research. Assemble all 4 elements together. The leafy greens reopen your vasculature. The olive oil extracts the accumulated debris. The fiber lowers your cholesterol input. The nuts pacify the inflammatory response. You are engaging the identical problem from 4 separate angles simultaneously. Now, here's what to avoid, because this approach fails just as readily as it succeeds. Do not consume this single configuration of foods and then proceed to ingest processed items for the remainder of the day. This isn't a mystical barrier shielding you from an otherwise destructive diet. Do not eliminate the olive oil to preserve caloric intake. Its beneficial compound constitutes the entire rationale. A plain salad devoid of genuine olive oil remains merely a salad. Do not purchase cheap refined oil anticipating identical outcomes. You are squandering resources and receiving virtually none of the substance that genuinely produces results. If you wish to ascertain whether this intervention is effective for you, don't rely solely on subjective sensation. Inquire with your physician about that same straightforward cervical scan Robert underwent as an initial benchmark and contemplate repeating it after several years. That furnishes you a concrete physical metric of the precise variable this dietary pattern is designed to modify. Request measurement of your triglyceride level and your protective cholesterol alongside your standard lipid panel, not merely your harmful cholesterol in isolation. Because those 2 figures shift earliest when a low-fat, high-refined carbohydrate diet silently undermines your progress, frequently before your harmful cholesterol figure reveals any anomaly whatsoever. And should your physician facilitate it, a blood assessment termed high-sensitivity C-reactive protein quantifies inflammation directly. A value beneath 1 signals low hazard. Above 3 indicates genuine active inflammation circulating within your body, the very same inflammatory process fueling the deposits we've discussed throughout this entire presentation. These aren't metrics requiring daily fixation, but evaluated annually in conjunction with your routine laboratories. They convey substantially more about the genuine activity within your vessel walls than your total cholesterol figure ever could in isolation. Let's address what you're likely contemplating, because I recognize these doubts. Firstly, doesn't this constitute a substantial fat load for someone concerned about their arteries? Your reasoning, 4 spoonfuls of oil daily. That represents significant energy. That cannot be appropriate for a cardiac patient. Yes, it embodies genuine fat. And that is precisely the objective. That Spanish investigation compared a higher-fat olive oil dietary pattern directly against a low-fat dietary pattern in subjects already harboring cardiac disease. It was the higher-fat cohort whose vessels demonstrated improvement. Here's a partial explanation. When you strip fat from your diet, your protective cholesterol, the variety that actually conveys harmful material away from your arterial walls, tends to decline alongside it. Suppress your protective cholesterol, and you weaken your own organism's capacity for self-cleansing. The olive oil cohort in that Spanish trial witnessed their protective cholesterol ascend, not descend. A secondary mechanism exists as well. When you excise fat from your nutrition, you don't simply consume less fat. You substitute it with something else. And for the majority, that substitute is refined starch and sugar. Your liver converts that surplus sugar and starch into a fat variant your body dispatches through your bloodstream, designated as triglycerides. Elevated triglycerides compress your cholesterol particles into smaller, denser forms. And small, dense particles infiltrate your vessel lining far more readily than the larger, fluffier variants, and they oxidize and convert into deposits more readily as well. A low-fat, high-carbohydrate diet can leave your harmful cholesterol figure appearing acceptable on a report while silently rendering your actual particles more hazardous beneath that figure and your protective cholesterol feebler at cleansing any of it. Fat was never the authentic adversary here. Cholesterol that has oxidized within your vessel wall constitutes the adversary. Persistent inflammation constitutes the adversary. The category of fat you ingest matters more than the quantity of fat you ingest. That isn't my personal viewpoint. That's what a genuine study in genuine cardiac patients discovered. Secondly, does this substitute for my statin prescription? It does not, and I require you to register that distinctly. Robert maintained his prescription through every single year of this protocol. This dietary approach doesn't replace what your medication accomplishes for your cholesterol figure. It pursues the inflammation and vulnerability your medication was never engineered to address. Deploy both in concert. Thirdly, why hasn't my physician placed me on this precise regimen? Because a 15-minute consultation is structured around your laboratory results and your prescriptions, not a detailed walkthrough of a Spanish cardiac trial. Most physicians receive minimal instruction regarding nutrition during medical training, and the instruction they do receive seldom penetrates to this depth concerning one specific dietary pattern. I wish to remain forthright with you regarding another point as well. This isn't even the sole validated pathway. In the 1990s, a physician named Dean Ornish placed patients with severe cardiac disease on a vastly different nutritional regimen, exceedingly low in fat, predominantly botanical, nearly devoid of oil entirely, combined with physical activity and stress reduction. He imaged their vessels before and after using genuine angiographic imaging, and the blockages contracted. Around the same epoch, a surgeon named Caldwell Esselstyn accomplished something analogous with his own patients and observed the same category of improvement. Both methodologies are legitimate, both are published, and they occupy nearly opposite extremes regarding fat intake. One exceedingly low, one constructed around a specific high-grade fat. What I'm conveying to you currently inclines toward the second pathway because the trial data underpinning it is more extensive, more contemporary, and because in my clinical observation, patients genuinely adhere to a plate featuring quality olive oil and vegetables for years, whereas a near-zero fat diet exhausts most individuals within months. Both possess validity. I'm presenting you the one I've witnessed real patients maintain. I'm weary of observing patients follow every directive they received, achieve a normal cholesterol figure, and still arrive on my operating platform because a normal figure was never the complete narrative. I'm weary of opening chests that never required opening because no one clarified the distinction between lowering a number and genuinely pacifying the activity unfolding inside the vessel lining. Fourthly, does this connect to blood pressure? Directly. The identical insult to your arterial lining that constructs deposits stands among the primary drivers of climbing pressure, and the nitrate-dense leafy vegetables within this precise dietary configuration are among the most validated food-based instruments for driving pressure downward. If your readings register elevated, that isn't a disconnected problem from everything I've shared with you today. It's the identical struggle perceived from a different vantage point. That's precisely what I detail in the pressure protocol, constructed from the same 2 decades underpinning everything in this presentation. This isn't a complimentary brochure, it's a comprehensive, detailed blueprint. And if it spares even a single one of you from my operating platform, it justifies its value entirely. The pathway is positioned directly for you. Incorporate nitrate-dense leafy vegetables daily. Transition to genuine robust olive oil, 3 to 4 spoonfuls, in place of your existing cooking fat. Construct your plate around beans, lentils, or oats. Add a modest daily palmful of walnuts. Maintain your statin prescription precisely as directed. Execute this consistently for years, not weeks, and you aren't chasing an illusion. You're enacting the singular intervention the authentic evidence indicates genuinely shifts your arteries in a favorable direction. That's the reality, and it was always destined to be more compelling than the myth. If this altered how you see your own vessel health, tap like and mention my channel so more people find this information before they find themselves in a surgeon's office.